What if the next step you take decides whether you'll dance at your granddaughter's wedding or watch from a folding chair? 1 in 4 Americans over 60 already struggles with daily tasks because of stiff, aching joints. Meet Mrs. Thompson, 72, who traded her walker for morning Tai Chi after a few simple tweaks. Cartilage thins for years, but today we'll reveal a friendly, step-by-step plan to keep you moving. 1. The hidden dangers of ignoring joint pain. Honestly, ignoring those first twinges is like letting a dripping faucet rot the floorboards beneath it. Within weeks, micro tears inside your cartilage spark flare-ups that make bending for the dog's bowl feel like kneeling on gravel. The ache doesn't clock out at night either. Studies show that seniors with arthritic pain lose nearly 1/5 of their deep sleep cycles, waking groggy and irritable. Give it 6 months without action, and the ripple widens. Because sore joints beg for rest, thigh and calf muscles can shrink up to 3% each month, erasing the very support those joints rely on. Balance suffers, and the risk of a hip fracturing fall doubles, something American ERs see every 11 seconds. Stretch that inertia over a few years, and independence itself is on the chopping block. 58% of older adults who move into assisted living communities cite joint limitations as the tipping point. Less movement also nudges blood pressure and weight upward, inviting heart disease, diabetes, and a gloom of depression. Here's the upside. These outcomes aren't carved in stone. Addressing joint stress early can rebuild strength and confidence. Let's map out the natural, layered fixes that turn the tide. Your future mobility really is negotiable, with effort. 2. The 3-layer natural remedy blueprint. We turn the ship around with a 3-layer plan that respects both biology and busy American lives. Think of it like building a good house. You pour a sturdy foundation, add supportive framing, then finish with smart upgrades and ongoing inspections. Each layer solves a threat we just heard about. First, quieting inflammation, then rebuilding strength, and finally keeping gains on autopilot. So the fixes work in concert instead of feeling like a jumble of wellness trivia. A. Foundation layer. Weeks 1 to 2. Movement comes first because cartilage is nourished by motion, not magic. Aim for 150 minutes of low-impact activity a week. That's just a 30-minute walk or pool session 5 days out of 7. Water walking at the local YMCA, chair yoga streamed on YouTube, or a gentle neighborhood stroll after dinner all count and cost next to nothing. Pair the motion with a Mediterranean-leaning plate. Fill half with colorful produce, reserve a palm-sized space for salmon or sardines twice a week, and swap butter for olive oil. Omega-3 fats and antioxidants act like firefighters, cooling the microscopic flames that chew up joint surfaces. Last, step on a scale. Every extra pound exerts roughly 4 pounds of extra pressure on your knees. Trimming even 10 pounds can slice knee pain in half. No crash diets, just mindful portions and an extra serving of leafy greens. B. Optimization layer, weeks 3 to 6. Once daily motion feels routine, it's time to plug the muscle leaks that left your joints wobbling. 2 or 3 mornings a week, loop a resistance band above your knees and practice slow squats to a tall chair. That single move strengthens quadriceps and glutes, the body's built-in shock absorbers. Follow with 10 wall push-ups to wake up stabilizing shoulder muscles. To complement the work inside, spice up meals outside. Add a teaspoon of grated ginger to oatmeal or stir-fry, and consider a 500 milligram curcumin capsule with lunch. Clinical trials show this duo can dial pain down 20% in 8 weeks. Footwear matters too. Swap worn sneakers for a pair with a cushioned midsole and a slight quarter-inch heel drop. The investment often pays for itself in fewer physical therapy bills. If store aisles overwhelm you, ask for walking shoes labeled maximum cushion and neutral support. C. Enhancement and monitoring layer, months 2 to 6. By now, the foundation is solid and the frame secure, so we fine-tune. Many doctors recommend a 3-month trial of glucosamine, 1,500 milligrams, paired with chondroitin, 1,200 milligrams, to ease morning creaks. Buy a brand stamped with the USP or NSF seal so you know the dose on the label matches what's inside. Schedule an annual gait assessment at a local physical therapy clinic, often covered by Medicare Part B or many private plans. A quick video analysis can catch uneven stride patterns that overload one hip. Finally, let technology nudge, not nag. Set a wearable to buzz if you sit longer than an hour, or use a free phone app that logs pain scores and step counts in one place. Watching data trend upward, say from 2,000 to 4,000 steps a day, builds the confidence that keeps the plan rolling long after this video ends. Stitching these layers together creates a virtuous cycle. Movement bathes joints in healing fluid, stronger muscles shield cartilage, and ongoing checks prevent small issues from ballooning. Still, life isn't one size fits all. Water aerobics may bore you, ginger could clash with blood thinners, or the nearest pool might be 30 miles away. In the next section, we'll swap in equally powerful alternatives so every viewer can pick tools that fit budgets, tastes, and medical realities without drifting off course. 3. Flexible alternatives that fit your life. Flexibility keeps a plan alive, so let's slot in substitutions that hit the same goals without forcing you into a mold. A. Movement swaps. If pool lanes or long walks feel unrealistic, a seated Tai Chi flow delivers the same joint lubricating motion while letting you stay planted in your living room recliner. Pair it with a compact under-desk pedal cycle, about the size of a shoebox, to sneak in calf and thigh work while watching evening news. Both options respect bad weather, limited balance, or tight budgets, yet still feed cartilage the movement it craves. B. Dietary pivots. Seafood prices or allergies getting in the way? A lentils, quinoa, walnuts, kale supplies omega-3 cousins called ALA, plus a fiber boost that tames cholesterol. If chewing leafy greens is tough, toss them into a blender with frozen berries and almond milk for a joint-friendly smoothie. For an extra collagen nudge, sip a mug of slow cooker bone broth. Its amino acids may help cushion knees, especially on chillier mornings. C. Pain relief options. Stomach can't handle turmeric capsules? A dab of over-the-counter capsaicin cream rubbed on sore knuckles 3 times daily blocks pain signals locally without taxing digestion. On winter evenings, a 10-minute warm paraffin bath soothes stiff fingers. Simply melt the wax in a small crock pot, dip, cool, repeat. It's a spa trick many physical therapy clinics now recommend for home use. D. Equipment tweaks. Rough country roads or forest trails might punish ankles, so swap basic sneakers for Nordic walking poles. The poles offload up to 20% of knee stress and turn a stroll into a gentle whole-body workout. For gardening or church steps, lightweight elastic knee sleeves add warmth and proprioceptive feedback that reminds you to keep joints aligned. Choose the pieces that match your lifestyle, wallet, and medical reality. Mix and match as needed. The guiding rule is simple. The substitute must serve the same purpose, move, nourish, or protect, without adding new risk. And speaking of risk, let's put safety rails around these choices before you rush to the checkout aisle. 4. Safety rails. Contraindications and warnings. Before you add anything new to your cart or your dinner plate, pause for a quick safety check. Certain health conditions and medications can turn even a natural aid into trouble if you don't clear it with your doctor first. For example, high-dose turmeric can strain kidneys already working overtime, so anyone with stage 3 or worse kidney disease should skip capsules and stick to culinary pinches. If you manage diabetes with warfarin or another blood thinner, glucosamine may push your INR numbers into the danger zone. A simple phone call to your primary care team prevents that surprise. Low-sodium diets, common after heart surgery, also clash with bone broth's salty punch. Tasteful alternatives like unsalted lentil soup keep the sodium police at bay. Even if you're otherwise healthy, your joints will tell you when a remedy isn't right. Stop immediately and seek medical help if a knee balloons to the size of a softball overnight, if pain turns sharp and stabbing for more than 48 hours despite rest, or if you spike a fever, signals that infection or gout might be masquerading as routine arthritis. The same red flag flies if numbness creeps down the leg or hand. That could hint at nerve pinching that exercise alone can't fix. Mind the dosage too. Turmeric beyond 2 grams per day, ginger above 4 grams, or curcumin capsules taken alongside multiple anti-inflammatory drugs can tip the stomach into nausea or the liver into overtime. With resistance bands, respect progression. Stay at light or medium tension until your physical therapist or your own mirror confirms solid form. Pushing into ultra-thick bands too soon may yank tendons instead of building them. Quality matters as much as quantity. Look for supplements stamped USP, NSF, or Consumer Lab verified. Those seals mean what's on the label actually shows up in the pill, and that heavy metals stay out. Skip any product that hides behind a proprietary blend because you can't watch what you're swallowing. When buying knee sleeves, choose breathable fabric and the correct circumference. Too tight may impede circulation, too loose won't stabilize. Safety rails in place, you're cleared for the fun part. Tracking the wins. In the coming weeks, you'll want proof that the aches are easing, strength is rising, and sleep is stretching. So how do you spot authentic progress and know when to tweak the plan? Let's zoom in on the early green lights and the telltale caution signs that guide your next step toward pain-free motion. 5. Tracking progress. Improvement indicators. Progress hides in everyday details, so we turn anecdote into evidence. Keep a simple notebook or a notes app on your phone where each day you jot the date, what activity you tried, how stiff you felt getting out of bed, and any aches that showed up by evening. With just a minute's effort, you build a map that shows whether the plan is paying off or quietly veering off course. During the first 2 to 3 weeks, look for rapid-fire wins that whisper, "We're moving in the right direction." Morning stiffness should shrink from a half hour to 15 minutes, and you may notice you can rise from a dining room chair 5 times in a row without groaning. Pain scores, if you use a 0 to 10 scale, often fall a notch or two as synovial fluid starts flowing more freely. Celebrate these micro-victories. They recruit the brain's reward circuitry and keep motivation humming. By months 1 to 3, the markers get more concrete. Perhaps your smartwatch shows daily steps climbing from 2,000 to 4,000, or the timed up and go test, standing, walking 10 feet, turning, and sitting, drops by 2 full seconds. Many folks report sleeping through the night without that throbbing wake-up call around 2 a.m. And single leg balance can stretch from a shaky 3 seconds to a confident 10. These are objective gains you can brag about at the next family barbecue.
Color code each week's log. Green when you meet or beat goals. Yellow when you plateau. Red if pain spikes or a joint swells. Greens mean keep cruising. Yellows signal it's time to tweak, maybe tighten the resistance band or add one more veggie serving. Reds demand a professional eye before you push further. The beauty of the system is its clarity. It spares you the guesswork that leads so many seniors to quit just shy of real improvement. Before we move into our wrap-up, take a breath and glance back at your imagined log. Do you see mostly green? Great! Momentum is on your side. If not, don't worry. The next part will show you how to fine-tune and get personalized support. Before the conclusion, I want everyone to comment below your symptoms or the type of disease you are concerned about. I will reply to the comments or reply in the next video so everyone knows how to handle it. I will help you have good health to be happy with the people you love. Don't forget to like and share with your friends to know more about this important knowledge.
6. Key takeaway and invitation to engage. Joint pain strikes first as a whisper and ends as a shout, but you now hold the volume dial. Recognize the danger, apply the layered motion nutrition monitor plan, swap wisely, protect yourself, and track the wins. Each small consistent choice, 5 more minutes of walking, a sprinkle of ginger, a nightly log entry, connects to the bigger promise, staying upright, independent, and ready for the next family adventure. Motion, not medication, is your joint's best friend. Move a little, gain a lot. Remember, cartilage can regenerate slowly when given movement and nutrients, and muscles rebound at any age, even into the 90s. Your timeline is flexible, but commitment starts today, right this moment.